as we welcome you back in to talk about a very important cancer that is affecting many people globally. Joining us this morning, a couple of doctors and specialists to explain why May is Brain Cancer Awareness Month. Gentlemen, good morning. Thank you for joining us.
Thanks for having us.
How many people each year does brain cancer impact?
Yeah, I would say it's a pretty rare disease. I mean, over a lifetime, maybe less than, for an individual, I would say your lifetime risk is less than 1% to get a brain cancer. But I should also mention that there are also other kinds of tumors that are benign, and that's actually the majority of primary brain tumors.
So there is a difference between cancer, brain cancer, and brain tumors.
The term is pretty much the same, but some cancers are more aggressive than others. Some are termed benign, where they're more slower growing, and others can be very quickly multiplying. Both can cause problems.
What are some symptoms that people should be on the lookout for?
I'd say you hear headache a lot, but I would say most people with headaches don't have brain tumors. Now, if you really have a brain tumor, other things can happen, and it really depends where it is and how big it is. For instance, it can affect how you move or how you feel things. If it gets big enough, you can also have things like nausea and vomiting.
Wow. But there's some challenges that you guys just mentioned, but there's also hope, right? What are some hope and some positive things we can look forward to and try to battle this challenge, this disease?
Yeah, so again, we're from Siteman Cancer Center and the Brain Tumor Center, and I think there's a lot of excitement and hope in the therapies that we're bringing to bear for patients. And it's not just taking care of people now, it's making the cures for tomorrow. And so we have a really robust pipeline of science that will become clinical trials and the medicines of the future. So we're really excited about the future.
What are some of those therapies you guys are looking through right now as far as looking toward to the future?
Some really exciting work using nanoparticles, very small particles, to deliver better drugs to the tumor. Some involve ultrasound to open up the blood-brain barrier. Others are using patients' own circadian rhythms to better deliver drugs at the right time, individualized therapy. There's also a lot of excitement about using the immune system to rev it up to see the tumor and attack it.
As two doctors who are pretty familiar, obviously, with this, when you see these kind of advancements being made, how does that make you feel as professionals?
Very hopeful.
Yeah, it's very gratifying. I mean, it's amazing when you can change the life of a person, let them do what they want to do, just live, you know?
When you do have someone come up and they are as grateful as they are and they say thank you, how does that make you feel? Do you feel like you're doing your job and you're helping? Yeah.
Of course. That's why we do it. I mean, it's a very rewarding career, very rewarding. You can help patients and build relationships over time that are very satisfying.
Where can people find more information about brain cancer and brain tumors?
Oh, so there are a few places you can look. Two great sites would be the Siteman Cancer Center site, and there's a Brain Tumor Center website on that. You could also look for the Brain Tumor Center WashU site. I would say those are the two places you can look.
All right, thank you very much, doctors. That's all the time we have. You can find this full information on our website, fox2now.com. Let's get over to break.